Hello and good evening. My name is Dr. Omair, and we are here to talk about some unique topic, and probably this video we are making for public awareness, and we have a very special guest to talk today on text neck syndrome. I think आप सभी ने सुना होगा, but we have today is Dr. Subhanjan Das sir. Das sir is an ex-principal from Bardhaman College of Physiotherapy, West Bengal. So sir sir is an expert in dry needling. He has been conducting a lot of workshops in around the country and some other countries as well. And sir has conducted more than 100 workshops and has been treating a lot of musculoskeletal cases, be it with cupping, dry needling, and some other treatment. So we will be talking on text neck syndrome. Welcome, sir, for our program. So sir, like आज जो हम ये प्रोग्राम है उसमें first thing is like we have been hearing since 10 years, 15 years down the line, we have been hearing text neck syndrome. ये now these days we are studying, we are learning as a medico, but neck pain रहता है लोगों को. Articles भी बहुत आते हैं, लेकिन what do you think, what is text neck syndrome? We want to explain it to the general population.
Okay. So text neck syndrome is a condition where, because you text a lot, as in your mobile you work a lot, your neck is placed in such a way that your neck gets strained, the neck gets a lot of pain. That is, in general, mobile or texting induced neck pain is called as text neck syndrome.
Okay. So sir, if we want to make people aware, what is the key point कि जिससे हम बता सकते हैं कि इनको text neck syndrome हो सकता है इस patient को या इस client को? What is that key point?
Okay. So the primary causative factor is texting. So if you are too much into mobile hours and hours together, then you are vulnerable for text neck syndrome.
Okay, sir. So second, I mean, we are here to talk about awareness more of in general people. I think prevention is better than cure. So the query might be after listening till the time. My second point will be, and even the people who want to know about, what are the factors that leads to text neck syndrome?
Okay. So there are basically two factors. One is excessive use of mobile and texting. The second is poor posture or wrong posture while using the mobile. See, normally our head, the shoulders and the hip are in one straight line, and this is very unique to the human being. You can say nature or God has given you a straight body. But when the mobile comes in your hand, we are always going in this position. So almost like the ear, shoulder and hip in one horizontal line, like a pig. So if you do that, the load in your neck increases a lot. Imagine it's like a golf ball on a tee. Your head is in normal posture, it will stay normally. But the moment you tilt, the head tends to fall down. So you need to pull back, and that's why a lot of muscles are going to work to pull it back. So if you can keep your neck straight while in a normal posture, while even looking at the phone, it is much better. But because of our habitual posture, because we are too much interested, we go inside the phone, and that's what makes our neck strain, and that's how we end up having text neck syndrome.
Yes. So sir, like everyone is texting, everyone is using the name itself is text neck syndrome.
Right.
And like, since everyone is texting, there is some condition called as text neck syndrome. What could be the early signs and symptoms, and how can we self-identify so that we can work on it as early as possible? We can prevent it as well.
Okay. So there are various ways. Some are more technical. So we physios, we have to come to us to diagnose. But if you are a little aware, you'll be able to. One of the things you can do is stand against a wall. And if you are able to touch both your shoulders, the back of your hip and the head in the wall, then you are reasonably okay. But if it takes a lot of effort for you to touch the back of your head on the wall, then you already have the tightness. One thing. Second is, say towards the evening of the day, if you are working too hard, you are having a heaviness in the neck, a little bit of dull headache, and you know that using mobile produces this headache or neck pain, then it is another early sign. and a late sign will be reduction in the range of motion. You will not be able to turn your head or up and down or in the side in the full range as you used to. So these are the basic early signs of text neck syndrome.
Now again we got to know कि समझ में आया कि text neck syndrome है, factors क्या क्या हो सकते हैं, early signs क्या है. But again there is a population or a crowd specific to job जिसमें ज़्यादा common है. So whom would you like to focus कि इनको they should be aware of it more of and उनको जानना ज़रूरी है and at the proper time they should work on it. So whom do you think it should be common in and who should work on it?
Right. So again, two types of population. One, the children who are getting a smartphone. 9th 10th स्टैंडर्ड में यूजुअली हम देते हैं बच्चे को, आजकल तो 4th 5th स्टैंडर्ड में भी मिल जाता है. तो उनको और उनके पेरेंट्स को ये अवेयर करना जरूरी है क्योंकि उनका बॉडी अभी भी डेवलप हो रहा है और वो गलत तरीके से डेवलप होगा तो शुरू से ही मैकेनिकल प्रॉब्लम आएगा. सेकंड, जिनका काम के वजह से उनको बहुत ज्यादा काम या एंटरटेनमेंट की वजह से यू आर टू मच इनटू अ मोबाइल. ऑल्दो वी से टेक्स्ट नेक, दिस इज बेसिकली अ मोबाइल इंड्यूस्ड सिंड्रोम. तो आप अगर टेक्स्ट नहीं करते हो, नेटफ्लिक्स देख रहे हो, फेसबुक कर रहे हो तो भी ये प्रॉब्लम हो सकता है. तो ये दोनों ग्रुप है और बहुत इजी है आजकल आइडेंटिफाई करना. आप कोई भी स्मार्टफोन उठा लीजिए, उसमें पता चलेगा कि कितना घंटा आप एक दिन में या एक हफ्ते में आप फोन यूज कर रहे हैं. तो इफ इट इज टुवर्ड्स द हायर साइड, you should check on yourself and you should avoid using the mobile too much.
Well, definitely those people should consider it and start working, at least be aware of it. And definitely I being a physio, we treat a lot of cases, but we have an expert here. We would like to hear what is the proper treatment for this.
Right. So पहले तो ये समझ लीजिए कि नेक पेन हो रहा है, हेडेक हो रहा है, दवाई खा के फायदा नहीं होने वाला है. लॉन्ग टर्म है. शॉर्ट टर्म में आप दवाई खा लेंगे वो पेन सप्रेस हो जाएगा. सबसे पहले ये मैकेनिकल प्रॉब्लम है ना, जो चीज नॉर्मली अलाइंड था वो मैल अलाइंड हो गया, मिस अलाइंड हो गया. उसको सीधा करने के लिए आपको मैकेनिकल प्रोसेस का ही जरूरत है. तो आपको एक्सरसाइज करना है खुद में और करेक्शन के लिए आपको फिजियोथेरेपिस्ट के पास आना है. पेन किलर इज अ शॉर्ट टर्म सॉल्यूशन, वेरी बैड सॉल्यूशन. तो फिजियोथेरेपिस्ट के पास आप जब आएंगे तो उनको एक ही काम करना है, उनको आपका अलाइनमेंट करेक्शन करना है और वो अलाइनमेंट बना रहे उसके लिए प्रिकॉशन लेना है. तो करेक्शन के लिए फिजियो आपके जॉइंट्स को मोबिलाइज करेंगे, फिजियो आपके मसल्स को जो टाइट हो चुका है उसको लूज करेंगे, जो लूज मसल है उसको स्ट्रेंथन करेंगे. स्ट्रेंथन मैं थोड़ा लूजली बोल रहा हूँ, देयर आर मेनी वेज टू वर्क ऑन दैट. और उसके बाद वो आपको तरीका बताएंगे कि कैसे इसको प्रिवेंट किया जाए. लेकिन ये समझ लीजिए कि टेक्स्ट नेक सिंड्रोम लगता है कि हाँ पुअर पोस्चर में पढ़ेंगे तो थोड़ा सा नेक पेन होगा, उसके आगे क्या होगा, उसके आगे बहुत कुछ हो सकता है. पीछे हमारे जो नसें होते हैं वो आपके ब्रेन तक ब्लड लेके जाती है. तो वहाँ भी अगर कंप्रेशन हो जाए तो दिस कैन बी वेरी डिजास्टर्स. आपको अगर प्री एग्जिस्टिंग कंडीशन हो और आप अगर अर्ली इंटरवेंशन नहीं ले रहे हैं तो दिस कैन लीड टू मेनी अदर कंडीशंस इंक्लूडिंग वर्टिगो, डिजीनेस. कभी कभी हो सकता है कि आपके ब्रेन की ब्लड सप्लाई के साथ भी थोड़ा ऊपर नीचे हो जाए. तो ये सीरियस कंडीशन है, इसके लिए आपको एक्सपर्ट के पास जाना है. एक्सपर्ट इज द फिजियोथेरेपिस्ट इन दिस केस.
Definitely, sir. Even I feel, I have been explaining in clinics also कि, for all the biomechanical, say, defaults or faults, we need to be work on, that the cause of the treatment. So definitely, medication is not the solution. Pain is an emotion. So pain is definitely need to be suppressed. For that, medication is important, but not for a long term, 100%. So yes, apart from all the medication treatment in physiotherapy, which all treatment would you recommend and how it works, and what is the key point of treatment too? I'm asking here for all the physios also, since we have an expert. So what is that, sir?
Okay, so we have to align the structures, that is the bones which are vertebra. उसके लिए आपको mobilization करना पड़ेगा. So you can do either a very common mobilization is reverse neck by Mulligan, या तो simple chin tuck retraction exercises with a little bit of overpressure will also work. इसके साथ साथ क्योंकि वो मेल अलाइंड है तो जो मसल्स है वो टाइट हो चुका है, तो एज अ फिजियोथेरेपिस्ट वी हैव टू work on the length and tension of the muscles. The tight muscles can be released in various ways. बेसिकली लेकिन दो प्रिंसिपल लेके, एक तो मैकेनिकल पार्ट, एक न्यूरल एज इन रिसेप्टर पार्ट। रिसेप्टर स्टिमुलेशन के लिए आप कपिंग कर सकते हो नॉन इन्वेसिव, यू कैन इन्वेसिवली, यू कैन गो फॉर ड्राई नीडलिंग। अगर आपको रिसेप्टर को बस स्टिमुलेशन करना है और इफ यू वांट टू जस्ट मेंटेन द पोस्चर, टेपिंग ऑफ सम काइंड विल वर्क, सो यू आर स्पॉइल्ड विद चॉइसेस। Mechanically, if you want to correct, then starting from manual myofascial release, आपको अगर डीपर जाना है तो लेयर्स और लेयर्स में आप कप से जा सकते हो, आप नीडल से जा सकते हो, आप ISTM से जा सकते हो, कैन डू मेनी थिंग्स अगेन। सो दैट इज वन थिंग, दैट इज आवर पार्ट। लेकिन हमेशा क्या है कि एज ए फिजियोथेरेपिस्ट वी कैन रिनोवेट द कार एंड गिव इट टू यू, लेकिन उस गाड़ी को सही तरीके से चलाना अगेन पेशेंट का रिस्पॉन्सिबिलिटी है। तो पेशेंट को अच्छा अर्गोनॉमिक्स मेंटेन रखना है, नंबर वन, एंड नंबर टू रेगुलर एक्सरसाइजेस करते रहना है। तो दिस ऑल स्टार्टिंग फ्रॉम द मैनुअल थेरेपी टू एक्सरसाइज टू टेकिंग दैट फर्दर होम, ताकि आपको हमारे पास बार बार आना ना पड़े। तो दिस इज अ होल कंटिन्यूम, दैट इज द ड्यूटी ऑफ द फिजियोथेरेपिस्ट।
So definitely sir, these all treatments even we have been experiencing, dry needling, cupping, strengthening is a part. So whatever, you know, and that is very subjective, I guess, according to the patient that differs, and whatever tool we are using we have to go symptom by symptom, and always we have to think like for a long term.
Correct.
So physiotherapy plays a very important role in that. That's the conclusion here. And sir, last question I would like to ask, you know, as we have been talking, prevention is better than cure. So what prevention, you know, and whom, which crowd, I mean, according to someone who is suffering from any specific neck condition, whom do you think that they what they should be doing to prevent it?
Okay, so first of all, we are made to move. If you don't move for say 45 minutes at a stretch, then what happens, you know, our tissues, they are like chewing gum. If you keep the chewing gum on the air, after chewing it will become hardened, so you tend to injure yourself. So first of all, you have to move regularly. Second, you have to minimize the amount of mobile use. If your job involves use of say some sort of mobile, including something like WhatsApp, take it in your desktop, laptop and use it. Looking at the screen with a poor posture is not the solution in the long term. So ergonomics plays a lot of role. Hydration, you have to drink at least 3 liters of water a day. That is important. Ergonomics, hydration, postural awareness. And then people who are, again, if you are using mobile, please use with the correct posture. Now, what is the correct posture? Many people will tell you that if you use the mobile like this, keeping the head and neck straight, that is correct posture. This is not going to work, because this distance increases the load on the neck. So either use a hand, like keep your hand on a table, that's a good way. Another is use it like this. Use the support of one hand and hold the mobile like this. But this also has some other problem, and it is going to reduce your chest expansion, so you cannot do it for a long time. And finally, we are tuned in such a way that every 5 minutes we check our mobile. So you have to suppress that urge. Nothing is going to happen. The world is going to survive even if you don't look at your mobile every 5 minutes. You know? So you have to suppress your urge. You have to train yourself not to look at your screen every time throughout the life.
Definitely, I think for those who have been suffering, they should consider all this. Beautifully explained by sir, and definitely I hope that everyone will, you know, share it to make people aware. Share it to your patients as well, so that in short we can explain them how to be aware and how to prevent it. That was a lovely talk with Subhanjan sir, and thanks a lot sir for giving your time. So that's it for today guys. We'll meet up again next time with new topic. Thank you. Have a great day.